We take the research you send us, all those stacks of articles and books, and boil it down to what you really need to know.
Yeah, we streamlined it for you.
Exactly. And today, we're tackling something pretty heavy, but really important. It's an unflinching look at death, the biological side, the emotional side.
We're diving into that gap, between the peaceful end we sort of hope for and the clinical facts.
Our main source here is the work of Dr. Sherwin Nuland. He was a surgeon, a historian at Yale.
Right, and he wrote this material with a very clear goal to demythologize the process of dying, to face the biological reality head-on.
He wanted to take away the fear of the terra incognita, the unknown territory of death.
But, how well did he actually manage that? Because it's tough. We all want dignity at the end, right?
Of course. But Nuland kicks things off with a really stark story. An attorney whose mother died in agony.
And the attorney's quote is just brutal. "There was no dignity in my mother's death."
Oof. Yeah, that quote really sets the stage for Nuland's central argument.
Which is?
That this whole quest for dignity, as we usually think of it, well, it often fails when our bodies fail.
So maintaining composure, control, that kind of dignity.
Yeah. He argues that's actually pretty rare. It often depends more on, luck or the specific way a disease progresses, not something you can just will into happening.
That makes sense. Our bodies just break down in ways we can't control.
And this idea feeds into how death has been portrayed, especially in art. We've been shown this serene image for ages.
Oh, yeah, like that famous painting, Sir Luke Fildes' The Doctor from 1891.
Exactly. You see the thoughtful doctor, the seemingly peaceful, maybe unconscious child.
It's the perfect Victorian picture, isn't it? Contained, quiet sorrow.
But here's the kicker. Fildes knew better. He wasn't just imagining this.
Right, his own son had died years earlier, probably from something awful like diphtheria.
Which means the reality would have been choking or maybe high fever, delirium, nothing like the painting.
So the painting is, as Nuland calls it, purely an image of wishfulness. It's what they wanted death to look like.
Wait, hang on. Fildes paints this peaceful scene after seeing his own son suffer horribly. But then you look back 80 years earlier at Goya.
Ah, Goya's El Garrotillo, the croup.
Yeah. That's completely different. It shows a doctor literally trying to rip a membrane out of a choking kid's throat. It's visceral. It's brutal.
And that contrast is key to Nuland's point. Goya's time, they lived with that reality daily. Fildes' time, they were maybe starting to push it away, idealize it.
So Nuland uses this to pivot, right? He says death itself isn't the enemy we should be fighting.
Exactly. Death is just an event. The real enemy, the thing we fight, is the disease. That's the malign force that requires confrontation. Death is just the surcease that comes when the exhausting battle has been lost. It's the end of the fight, not the fight itself.
Okay, that reframing is helpful. So let's look at how that battle is typically lost. Nuland basically outlines two paths: the sudden end and the slow decline.
Let's start with sudden. The most common culprit is ischemic heart disease. Nuland uses the case of a man named James McCarty.
McCarty sounds like a classic case. Lifestyle factors, maybe genetics?
Yep. Diet, smoking, probably genetic predisposition.
Yeah.
It all led to atherosclerosis, the hardening of his arteries.
Because of plaque buildup.
Right. These yellowish-white plaques called atheroma, which, interestingly, means gruel or porridge.
Gruel. Seriously, so it's like a little pocket of mush in the artery wall.
Pretty much. And when one of those ruptures, that gruel breaks open, the body tries to fix it.
By forming a clot.
A massive clot, yeah. And that clot can instantly block the artery, cut off blood flow to the heart muscle. That's acute ischemia oxygen starvation.
And that causes the heart's electrical system to just short circuit, leading to ventricular fibrillation.
Precisely. Ventricular fibrillation, or VFib. The heart stops pumping rhythmically. It just quivers chaotically.
What does that actually feel like or look like in a clinical setting?
Nuland doesn't shy away from it. He describes an attempt at open chest massage on McCarty. Holding the fibrillating heart was like grasping a, quote, wet, jelly-like bag full of hyperactive worms.
Oh my God, that's graphic.
It is. And there are other signs. McCarty let out the death rattle.
That awful rasping sound.
Yeah, caused by muscle spasms as oxygen depletes. And his eyes. Pupils fixed, wide, black, brain death.
It seems like Nuland includes these incredibly visceral details almost to, shock us into facing the biological facts. No room for sentimentality there.
I think that's exactly the point, to strip away the romantic notions.
But what about people who have that sudden cardiac event and survive? the near-death experiences. We have the story of Irv Lipsiner.
Right, the stockbroker who collapsed playing tennis. His account is really important because it challenges the idea of death being like flipping a switch. Instant lights out.
He didn't feel like that.
No. He described it as feeling like somebody took the life out of me, like he shrunk uniformly. But crucially because his brain was being starved of oxygen gradually.
Ah, so the lights didn't just switch off.
Exactly. He said they turned down gradually and almost in a spiral. It wasn't instantaneous.
That makes sense biologically. The brain needs constant oxygen. Cut that off, and it fails progressively, not all at once.
And it highlights how complex the heart itself is. This amazing four-chambered pump, driven by its own internal generator, the SA node.
The sinoatrial node.
Right. It coordinates everything. When ischemia hits, that intricate coordination just falls apart.
Okay, so that covers the sudden pathway. What about the other side, the slow slide? Aging, chronic disease.
Yeah, the long goodbye. And there's a weird paradox here, isn't there? Legally, you can't actually put old age as the cause of death on a certificate.
Really? So everyone technically dies of something specific.
Always. Nuland mentions his own grandmother, Bubba. Her certificate said cerebrovascular accident, a stroke, not just old age.
But old age is a real process, right? Senescence, the body wearing out.
Absolutely. It's the background noise, the fundamental breakdown that specific diseases like stroke or heart failure eventually exploit. Medical terms sometimes mask that underlying biological reality.
What causes that breakdown? Is it just wear and tear over time?
That's one major theory, accumulated damage. The other is that we have a kind of built-in timer, a genetic tape that dictates our lifespan. Probably a mix of both.
And the effects are systemic. You mentioned the heart's SA node earlier.
Yeah, that internal generator. It can lose up to 90% of its cells by age 75. Think about that.
Wow. And maximum heart rate drops.
About 1 beat per minute per year after a certain age. Everything just gets less efficient, less resilient.
Even things like bladder control. Nuland includes this incredibly poignant, almost mundane detail about his grandmother.
Oh, the coffee can.
Yeah, grappling in the dark with a large Maxwell House coffee can because her bladder couldn't hold as much overnight.
It's such a grounding detail, isn't it? It makes the abstract idea of losing function very real, very human, more than just statistics about cell loss.
It really does. So connecting this decline to specific diseases, Nuland talks about the posse of 7.
Right. He points out that something like 85% of older people eventually die from complications related to just 7 major conditions.
Why call it a posse? Is he implying they kind of hunt us down?
Sort of, yeah. It emphasizes that these are the big players, the usual suspects that our aging bodies become vulnerable to.
Yeah, they are.
Atherosclerosis, we talked about, that hypertension, diabetes, obesity, cancer, dementia, and just generally decreased resistance to infection.
That covers a lot of ground. And dementia seems like a particularly cruel one. It affects, what, 11% of people over 65?
And it's crucial to understand, as Janet Whiting learned caring for her husband, Phil, dementia isn't just getting forgetful with age. It's a specific, progressive brain disease.
Relentlessly progressive, lasting years sometimes.
Yeah, 3 to 15 years is the range. And Phil Whiting's story is just harrowing, the delusions, accusing his wife.
And then the physical decline, the obsessive walking.
Yes, this relentless need to move, walking until he was utterly exhausted. They eventually had to basically tie him into a chair.
Oh, trust into a chair.
And even then, his feet would still be moving, mimicking walking. Just heartbreaking, running from something he couldn't escape until he literally couldn't stand. He even forgot his own name near the end.
Awful. But his end was actually different, wasn't it?
Yes, in a way, he was spared the final stage of complete immobility common in late Alzheimer's. He died suddenly from ventricular fibrillation, the same heart issue we discussed earlier. A kind of biological reprieve, Nuland suggests.
Which brings us, maybe surprisingly, to the body's own defenses against suffering.
Right, this idea that even in violent or traumatic death, there can be a strange kind of tranquility.
That seems counterintuitive. You expect terror, panic.
But Nuland presents the case of Katie Mason. She was murdered, bled out from a carotid artery injury.
Horrific. Yet her mother, who witnessed it, said her eyes showed utter surprise, but explicitly not horror or panic.
How is that possible? It's biochemical.
Endorphins.
Exactly. Endogenous morphine-like compounds. The brain releases them under extreme stress or trauma. They essentially flood the system and short-circuit fear and pain signals.
Nuland cites other examples too, right? Like David Livingstone being attacked by a lion.
Yeah, Livingstone described a feeling of shock that just annihilated fear. Nuland even mentions a personal grounding scare where he felt a similar detachment, not panic.
So the body has this built-in, last-ditch chemical defense against overwhelming terror.
It seems so. It's not mystical, it's biology providing a cushion against the unbearable.
Understanding that chemical cushion, it forces us to rethink hope, especially when facing terminal illness. There's a difference between false hope and, well, necessary hope.
A huge difference. And Nuland is very honest about the dangers of false hope, using his own brother, Harvey, as an example.
What happened there?
They pursued aggressive experimental treatments, toxic chemotherapy, and Nuland admits they essentially lied to Harvey, keeping up the pretense that a cure was possible, all for the sake of hope.
But the result wasn't hope, it was just more suffering.
Exactly. Added anguish, wasted final months. Nuland carries real guilt about that.
So what's the alternative? What's necessary hope?
The source gives the example of Dog Dimites, another cancer patient. His hope wasn't for a cure he knew wasn't coming.
It was hope for meaning in the time he had left.
Precisely. Living consciously, focusing on connection, on love, on memory. He famously threw a final Christmas party.
And told his wife, you have to live before you die.
Right. His epitaph sums it up. He knew how to keep Christmas well. That became his form of hope, living well until the end.
That kind of honest living requires honest communication, though, which is often where things fall apart.
Oh, absolutely.
Yeah.
Nuland talks about his Aunt Rose and the lie of silence. It's devastating.
Describe that.
He says, we knew, she knew, we knew, she knew, we knew, and none of us would talk about it.
Wow. Everyone knew she was dying, but no one would say it out loud.
Yeah. And that silence, that charade, it prevents the final sharing, the comfort, the closure that people desperately need.
It's not protecting anyone, it's isolating them.
Exactly. And physicians sometimes contribute to this, maybe unintentionally. Well, there's the drive to solve the riddle, the challenge of the disease. And modern medicine has this powerful rescue credo. We're trained to intervene, to fix.
It's hard to shift from fixing mode to nurturing mode.
Very hard. Nuland gives the example of Miss Welch. She was elderly, ill, and clearly stated she wanted to die peacefully.
But her doctor operated anyway.
Yes. Why? Because he knew if he didn't operate, and she died, he'd face judgment from his colleagues at the weekly surgical conference. Peer pressure, essentially.
He saved her life, technically, but betrayed her wishes and her trust.
It shows how the system, the professional pressure, can sometimes override the patient's actual needs and desires for a peaceful, controlled end.
So wrapping this up, the main takeaway seems to be that the peaceful, dignified deathbed scene we imagine, it's usually, as Nuland says, an image of wishfulness.
Yeah, mostly a myth. By facing the stark biological realities, ischemia, the slow failure of aging systems, the way diseases actually progress, we can maybe let go of that unrealistic ideal.
And focus instead on what can be controlled. Managing symptoms, having honest conversations.
And redefining hope. Finding meaning, not in fighting a battle that's already lost, but in conscious living, in love, in shared memories, right up to the end.
There's also that really touching concept mentioned, especially regarding AIDS patients back in the crisis, the caregiving surround.
Oh, yes. That's powerful. Friends, family, loved ones, forming this tight circle of support.
Providing practical care, emotional support, but fundamentally, ensuring the person isn't abandoned, not left to die alone among strangers in a hospital.
It's about providing that human connection, that presence, which might be the most profound form of dignity we can offer when the body is failing. Selfless love in action.
So after confronting the biology, after redefining hope, what's the final thought here? Nuland seems to lean towards a kind of natural perspective.
He does. Drawing on thinkers like Thomas Jefferson, there's this idea rooted in natural law. It's a challenging thought, but maybe a necessary one.
Which is?
We die so that the world may continue to live.
Individual death as a requirement for ongoing life.
Right. Nature requires renewal. Cycles have to complete. So the tragedy of a single individual, when seen in the grand scheme of things, becomes part of the triumph of ongoing life. It's a tough perspective, but maybe it offers a different kind of peace.
A perspective that accepts death not just as an end, but as a necessary part of the natural order. Something to definitely think about.
Definitely.